What's going on, podcasting world? Welcome back to another episode of the Core Consult RX podcast. I'm Mike Corvino. With me, as always, Cole Swanson. And today we have three special guests phoning in all the way from Johns Hopkins Medical School. We have Ali, Lucy, and Neha. How's it going, ladies?
Doing great.
Hi, good.
Thank you all for taking the time to be on the show. I know you guys are obviously extremely busy with everything going on, but I wanted to take the time to talk to you all about your COVID-19 update page that you have on Instagram, because I thought that was really awesome. And just kind of wanted to touch base with y'all and see how we can support you and all that. So how did that kind of get started?
Yeah, I can talk a little bit about that. So first off, thanks so much for having us. We're super excited to be on here. So this all started in the middle of March when we were on our 2-week spring break during our third year. And I was on a trip to Canada, just having fun. And COVID really hasn't started then yet. But then the second week, I got back home from Canada to Boston, and then got an email on my phone saying that Johns Hopkins has canceled all clinical rotations for medical students for the next indefinite period of time. At that point, it was 2 months or something. And for the next 5 days, I was very angry, sad, confused, because I came back from spring break super excited to finish off my third year. I was starting off my pediatric core clerkship, super excited to talk to patients again after break. So when they announced that, I was super devastated. I picked up my phone call on March 17th on midnight, called both Ali and Neha up and was like, we need to do something. I'm going insane in my house. And so we were thinking, and after 30 minutes, we came up with this idea. We're all very much into news and love news updates, but realized that there was a lot of overwhelming news every single day about COVID, and a lot of daily rapid updates that were really hard to keep up with, especially after that 1 week of being at home and trying to figure out what to do. And so after feeling overwhelmed at the sheer volume, we realized that that we wanted a daily update of some sort about the news, so that it was easy for us to kind of keep up with the news and for other people in the world to keep up with the news. And so after this hour of FaceTime, we agreed on creating daily updates through infographics on Instagram. And we focused on both news updates in the US, and we realized that there was a lack of news updates in worldwide. And so we focused on both US updates, but also global updates as well. And so the next day we woke up and we were super excited. We bought this infographic website. Neha spent the whole day scouring the news, US global news. Ali and I spent the whole day trying to figure out making a template for our infographics every single for that night onwards. And then we spent from 7 a.m. until 9 p.m. And then we spit out our first infographics and got pretty positive reviews. And then after that, we were we need more people. And then that's kind of how we all got started.
That is awesome.
That's great.
Especially, I the whole 7 a.m. to 9 p.m. learning session. That's awesome.
Anything more than 12 hours is definitely up Mike's alley.
It means you're dedicated. I love it.
It was tough.
So do either or any of y'all have experience doing any kind of social media stuff like that, or social media education or anything? Or just kind of first time?
This is our first time, which is kind of interesting because I think all of us have only used social media from a personal perspective of, engaging with friends and keeping updated with people from all aspects of our lives, but kind of seeing it through a different realm of professional and education and reaching a wider audience has been really awesome because we haven't done that before.
Yeah. And as opposed to sending out, an email chain update, what prompted y'all to Instagram probably would be able to get a larger outreach, right?
Yeah, I think that was part of it. And then we also knew that during the time when the crisis was escalating, there was a lot of misinformation being circulated on social media. So we thought that would be a good platform to try to kind of confront rumors or myths with this account.
Yeah, great. And speaking of that, so you mentioned scouring various news resources and whatnot. Where do you get your sources from? I guess Johns Hopkins is like the epicenter of information, especially in the U.S., right? So do you have access to like Johns Hopkins database that others don't have access to, or where were you getting most of your stuff for your infographics?
Actually, Johns Hopkins has a really big coronavirus center or website. It's actually all open to the public, so
Right.
we don't have special access to anything, but that's been a really great source for us. We also will go and look at peer-reviewed journals like from Nature or from JAMA, and then our main news comes from like the main news outlets, like New York Times or BBC, and we always cross-check our outlets or stories to make sure that the stories are real, they're fact-based, and we have like a layer of vetting process to make sure that we're not presenting like biased information.
Great. Yeah. Awesome.
Have you guys had anyone reach out that is, there's people out there with absurd theories as far as this is big pharma trying to push their corona vaccine, and this is we started the virus to push big pharma. Any of those types of things, have they reached out to y'all or said anything over social media?
Actually, our audience has been pretty tame, I would say, which may speak to a lot of the, medical minded people that have come across our account. We haven't gotten too many like rumors or direct, provocative questions, but a lot of the questions that we do get are more just clarifying and wondering, what evidence is behind whatever we're presenting, which we're happy to confirm for them.
Yeah, that's awesome. We really haven't gotten too much because we've done 2 episodes on COVID-19, and I think I've maybe gotten 1 or 2 messages on people saying that we should be presenting the truth about COVID. And I'm like okay, we're not a conspiracy theory podcast, so
Right.
Though we could do one of those.
which I don't think it would do very well.
That'd be fun.
But
We did write a blog post that's posted through the Hopkins site, and on that page there were a lot of very interesting questions that came up that actually did have some kind of conspiracy theory things related to them. But since it was directly on the Hopkins page, we are not authorized to reply to those. But I think it just spoke to the fact that anything kind of related to COVID, like just meant like that blog was about our origin story. Like anything related to that, people will respond to in some way because it's just, overtaken every aspect of life right now.
yeah. So, did the school say anything as far as you guys starting this? Or did you have to get their permission or anything, or how did that work?
Yeah, so when we first started this, we kind of went on a whim, and so we didn't want to get the school involved. We just wanted to make sure that we were able to even like produce something ourselves. And so when we started off, we like told our classmates, but we didn't blast it over the school email so that any of the administrations could see it. And then we started growing. We slightly reached out to some of the people at Hopkins, and then didn't really get that much traction there, like when we were starting off. And then later on, there were some opportunities to take online elective classes at Hopkins.
Related to COVID.
And some of our students were able to go take that class and kind of show over our infographics to one of the faculty members who were leading it. And that faculty member happened to also work at Hopkins because he was teaching that course. And so that was kind of our introduction to Hopkins. And then that faculty member was able to take it to like our deans and other people at Hopkins, and we got a lot of good feedback. There's been some chains back and forth about how they can help us and support us. And I think this was also after, like, they helped us get the blog post out on Hopkins website, and that was able to get posted on some of the Hopkins networks on like Twitter and Instagram and Facebook. And so I think like after a month of our Instagram, we were able to get some of Hopkins support, and it has been pretty nice and helpful.
Yeah, that's awesome. How do you feel as far as, are you guys kind of like one of the first group out of your class to do anything like this with social media, like education in general, not just necessarily COVID-19, but I know that you said this is kind of a new territory for y'all, but does Johns Hopkins do anything like Instagram education or any other social media type education like that regularly, or are you guys kind of like pioneers in this space for the whole university?
Well, so I don't think we are the first of the social medias. I actually think like Osmosis was founded by Hopkins students. I don't know if you know but Osmosis is like a social media. Yeah, but they were actually founded by Hopkins students a while back.
And then also clinical problem solvers. Yeah. A Hopkins attending physician was also involved in that. So we've known about certain social media avenues for education, but I think like in our class, in our kind of cohort of people, we haven't come across anyone who's really delved into it. And so it's been interesting to kind of delve into that whole new world of social media and how to portray yourself and get a larger audience with that.
So one of the things that I know our listeners are probably sick of me hearing, and I definitely know my students that I like mentor and things are sick of me hearing me say, is that I kind of feel like in this day and age, as far as like building your CV and things like that, everybody kind of does the same sort of things. They volunteer, they do different things at different clinics, they deal with projects, research, whatever it is. And I feel like there's a huge like area for students to start utilizing social media education to kind of like be innovative and come up with new ways to not only network, but also educate, up and coming students or undergrad students or whatever the case may be, that I feel like a lot of them don't take advantage of that. Now that you've kind of gotten some traction, you guys have 3,000 or 4,000 followers in a month. Which is
we're almost at 6,000.
Are you with
nice.
that? Jeez.
Don't short them, Mike.
Sorry. No, I mean, that's crazy. I'm jealous. It took me forever to get 6,000 followers.
Yeah, I know. I was there.
So, I mean, do you feel like this is, now that you've kind of seen this process and seen the kind of attention you can get from the, medical professionals in general, do you feel like this is something that more people need to start taking a look at?
Yeah, I think it's something we definitely talked about, not just specifically for COVID related things, but other potential infographics related to medical education would be something to try out. But I think it will depend on our schedule and things like that. But I think we're gonna, I think it's definitely something that I want to try to continue to grow in the future. I'm specifically interested in pediatrics, and I think it's a great way to try to teach about certain clinical topics related to pediatrics, or certain mechanisms. I think some of our best posts are detailing the scientific mechanisms of things, and I think in my clinical year, I've forgotten a lot of those. So I think that's definitely something that would be interesting to delve into in the future. But I'm not sure if that answers your question completely.
No, that's great. I was just curious your thoughts. There was no, definitely no right answer or anything. But, and I noticed too, you guys have been doing Spanish versions of all your posts too, which is awesome. That's something I saw that and I was like, man, I need to find some more friends that speak Spanish and really step up my game. But I thought that was great because that broadens up the, audience huge. So, how many, hours do you spend a day working on this kind of stuff right now? Because it's got to be a lot.
Yeah, I mean, if you can't tell, we were already very close friends before all of this. And so I think that's helped kind of propel it forward. But we probably spend a lot of hours at least talking about it. And it's been great to get other students involved at Hopkins who can, carry the momentum and be able to kind of introduce their own voices and perspectives to certain topics that come up. But in the beginning, we definitely spent, at least 4 hours per day.
Yeah.
Which is great because in this void of clinical rotations, we haven't had a lot of, outlets for all of our extra time. So,
right. As far as deciding what to post, did you take questions and people sent recommendations, or were you seeing information on other forms of social media and you were like, that's not right. We need to, we should make a post about that because there's a lot of misinformation. How'd you decide what you should post?
Yeah, I think it's a combination of both. We definitely have what's nice about social media is you can interact with your followers. So we definitely have gotten questions that we try to answer in comments as well. And then I think what we decide to post really kind of depends on what is like in the forefront of the news and what kind of misinformation can be spinned off of that. So like recently, there was a lot of news about Kawasaki disease, complication in children. So there's a lot going around about that and what exactly is Kawasaki, like how is this presenting differently? So we made a post about that, and I think some of the comments and messages we got were that it really like cleared up some of the information that presented in the news.
Yeah.
We also try to be kind of diligent on like whenever, so at night we have all the news updates, but in the morning are all kind of like the miscellaneous science topics or economic topics or other news topics. We try to be diligent on trying to post topics that are, like Neha said, like on the front page of everything. So like 2 days ago, the Moderna vaccine came out. And so like that night we were like, we need to put something out about the mRNA vaccine. And so we like, whenever we have a bunch of topics that are laid out for the next week, but whenever there's like a
breaking news.
Right.
Yeah. Breaking news. We're just like, okay, we need to get that out by tomorrow.
It's also interesting because a lot of the news stories that are featured will reference certain literature studies or scientific studies, but it's not really delved into specifically for a layperson what these studies entail or go into. So a lot of times we kind of cross-reference and look at the actual, medical literature that the news story is referencing so that we can kind of break it down for our audiences that may not have that scientific background.
Right. So is that your primary audience? So you decided to gear this more towards the lay public and people to get general information as opposed to like scientific stuff or treatment, things that you would try to give to a provider?
Absolutely. Yeah. We've tried to make everything understandable for someone with, high school education who doesn't have as much, scientific focus in the rest of their education. But of course, it can be hard to relay all these complex topics. So we do our best.
Yeah.
Yeah, you start getting into like relative risk reduction versus absolute risk reduction. It gets a little crazy when you're trying to talk to people who have never been in the medical world at all.
Absolutely.
So, what are y'all's thoughts about how things are progressing? I mean, I don't know how it is where y'all are, but I know for us, stuff's starting to open up. The quarantine's like really, lifting. Restaurants, I got my haircut finally. And things are kind of underway. And I know like at our testing center anyway, because we're doing like mobile COVID-19 testing in my clinic. And, we've started to see, we tested like 370 patients, I think last Thursday. And then today we got closed down because of a tornado, but the day before that we were like 150, 200. So we're starting to see a decline in people getting tests. How do y'all feel like everything's kind of progressing? Think it's going to be another surge again once everything opens up, or what's y'all's thoughts? And again, I'm just trying to get y'all's thoughts, not trying to put you on the spot at all.
So I think it's interesting in putting out these graphics. We've been keeping up to date with some of the trends by state and then, what the recommendations are for reopening. So it seems like, most states are reopening too soon. And given how their cases looked and then just the capacity of spread or testing everywhere. So, I don't think it's impossible that there would be another surge in cases if, precautions are not taken properly and social distancing isn't continued. So I think, it's not something that like, I'm happy like to say, like, I think, we'll have like another surge, but I feel like it's a real possibility.
Yeah. So as far as y'all's fourth year and, going forward, have you gotten an idea? Is you going to go forward as usual, or are they still holding off on your rotations, or how does that work?
Yeah. So we just got an email a couple of days ago that some students we're doing like starting to roll in students in chunks. So some students are starting next week. And then everyone else is starting on July 6th with clinical rotations. And so that just means that we'll just get a little bit more busy. But as things move forward, and we get busier, and COVID starts to kind of die down in the news a little bit, I still think that like, even if stuff like gets reopened and like the virus kind of goes not in the forefront as much as now, there's still going to be a lot of COVID news out there. And so as people start getting busy, things start reopening up, people will get even busier to start reading the news and staying updated every single day. And I think it will still be important for us as an Instagram account, with the followers that we have now, to keep them continue to be updated every single day. And we have a plan for that going forward. We've had a couple, like multiple students, many students who are interested in our group right now, who are helping us, that are a lot of first and second years, who are about to go on their summer break instead of going into rotation. So they have a little bit more time to help us. But we are anticipating that it's going to get a little bit busier for us, but we're trying to figure out some backup plans, but make sure that we continue to get the news out every single day.
Yeah, 4 to 6 hours a day while on rotation, I'm sure. Not the easiest thing to do.
Not good.
Be a lot of 10 to 2s, right?
Yeah.
Yeah.
I mean,
it's also been interesting because as a medical student during this time, when clinical rotations are paused, we're kind of in the middle of being useful and not being useful at all, because they're telling us that it's not safe for us to be in the hospital, but we've spent the last few years trying to learn to be able to contribute to patient care. So I think it'll be interesting as they phase in the student involvement going forward, being able to, be able to contribute in the hospital setting again, and kind of contrast that with being on the sideline.
Right.
How do you all feel as far as kind of getting back into the swing of things? I mean, are you anticipating being utilized in the hospital setting for patients that could at least suspected COVID patients, or is that kind of a little bit nerve-wracking? Are you excited to get in there? How do you feel?
I'm very excited to get back in the hospital. I've been like fidgeting at home trying to get back into the hospital. I think that Hopkins is trying their best to not let us interact with a lot of the suspected COVID patients. But of course, like, it's very hard to be in the same hospital with patients who are suspected or have COVID. So I think it'll be very fun to go back in the hospital, but obviously like kind of scared or kind of just nervous to be in that type of environment, since we haven't like interacted with these with patients in a while. But I think Hopkins is trying their best to make sure that we don't get exposed as much as possible, or that we have the proper protective equipment.
Right.
If we do.
Right. Hopefully you'll don't have a preceptor like me who puts you in PPE and it kind of brings you with me to testing sites.
At least you put them in PPE.
Yeah. I was joking with for those of you listening, I have 2 of my PharmD students are sitting behind us listening, but I was joking with them because after the first day of testing, I was like, I probably should email the school and make sure this is cool. I didn't really ask anybody.
You're more of a ask forgiveness than permission guy,
that
right?
is true.
Yeah.
But it's been weird to see like masks and N95s just in the lay person's vocabulary, and to see surgical masks used outside the OR is pretty surreal, when we've been on our surgery rotations and only kind of seen it through that lens. So yeah, being back in the hospital will be interesting.
Yeah, for sure.
Any of y'all have like critical care rotations or any kind of ICU rotations coming up where you might see the worst of the worst kind of thing?
Not yet.
Good. Probably best.
I'm sure you're not super excited to have to intubate someone who with COVID-19.
No.
So what's kind of the plan going forward as this stuff, does hopefully inevitably start to slow down and that kind of comes out of the news? I know, Lucy, you were saying you're planning on at least keeping up with it and keeping the site going, but do you guys have any idea as far as where you want to take this even outside of COVID-19? Are you going to continue to do social media education? And
would you consider like merging the page into some other topic or something more general, come, I don't know, next year or later this year when COVID's less in the news, maybe?
Yeah, I think kind of before, when we started this, one of our inspirations was the up-to-date page. and the founder unfortunately passed away from COVID complications, but we kind of wanted to be able to use our education and our time at this point to provide an up-to-date resource for people who may not have time to filter out everything in the news, just like he provided on that medical site. And so I think going forward, as we have less time, but also like the general public has less time to delve into everything happening, it'd be great to kind of broaden our focus and be able to provide up-to-date news that may be scientific, but not related to COVID, as hopefully we can, pass the urgency of the COVID times.
Yeah, and who would be better equipped than some medical students from Johns Hopkins?
There you go.
To give out the information. So what's the teaser for the next post? Do y'all have a plan? You're working on it after this, or what's the plan for the next thing?
We're going to go ahead.
Oh, I was going to say our post tomorrow is actually related to Asian American Heritage Month, and just discussing the rise in xenophobia and discrimination that has occurred during this pandemic. And then our posts that kind of we usually try to have them like a week planned in advance, but it can change day by day. So after that, we probably delve into more like some of the different treatments are being experimented for COVID, and then also how COVID spreads, the different mechanisms for that. And then maybe we have some collaborations with some other Instagram accounts also in works right now.
Great. Wow. A week in advance is how that, could you imagine planning your posts a week in advance?
I can't.
Or even the podcast topic a week in advance?
Yeah. In fact, I just sent Cole the podcast we're going to record after this one. I literally just sent him, it's a real patient case that I had on Friday. I literally just sent him all the labs and everything, maybe 2 hours ago?
Maybe.
I was like, no practice. We're going to have to just jump in there.
No practice on game day, right?
And just so y'all know, you're actually exactly at 6,000.
6,000 on
now.
the dot.
We just saw it.
Oh, great.
Nice.
While you're on the air. I love it. So, no, that's great. 6,000. This page started, 2 months ago? 3 months at the most?
2 months.
2 months.
We celebrated our 2 months 2 days ago.
That's awesome. So I'm going to feel real bad about myself when you guys fly past me.
Oh, they'll be past us by the end of the year.
Yeah, at the end of the year, I'll be done. I'll have to quit. I'll have to find a new hobby. No, that's awesome, y'all. That's really, really impressive, especially with everything going on. I'm looking forward to kind of keeping up and watching, y'all progress and keep posting great information. So where can people find you? So what's the Instagram handle and all that fun stuff?
So our Instagram, you can find us on our Instagram handle at COVID up to date. The 2 is the number 2 and not TWO. And you can use that same handle for both Twitter and Facebook, but our main page is on Instagram.
Do you guys have a page like email or anything that's associated with it?
Yes, it's the same, COVID up to numerical 2 date at gmail.com. And so if anyone has any ideas or suggestions or wants clarification, we're pretty open source and all of our stuff is available on Instagram, Facebook, Twitter, but we're also happy to answer questions or take suggestions for any posts or ideas people have as well.
Nice.
Man, that's awesome. And we'll put your handle and email and everything in the show notes as well, because this will probably be out as of tonight. So we'll get that out there. And what can we do to support y'all other than getting anything else besides getting the name out there and letting everybody know where you're at?
Yeah, this has been wonderful. I think your support is great. And if you have any ideas or posts or questions that have come your way regarding COVID, we're happy to, take a look at those and be able to provide infographics to educate the public. But everything that you're doing is also amazing. So we're really grateful.
No, thank you. So, and I'm hoping I get to see the Johns Hopkins students podcast starting eventually that I can start listening to.
Well, Allie really wants to make a podcast.
So
there you go.
I want to make a documentary. I don't know if that'll happen. I think with political rotation starting up, I missed my window. But
what kind of documentary you want to do, Allie?
I'm unsure, but if you have an idea, we can make something happen.
How about what fourth year of medical school looks like, so people can appreciate what y'all have to go through.
Sure, you can get Netflix to sponsor it, have all the income you need, you'll be good to go.
Sure.
Even if you don't get
Done.
Netflix to sponsor it. No, I mean, honestly, I feel like, especially if you have multiple episodes worth and kind of document your process through the end of medical school and even like starting residency and all that, I think, that would be the easiest way, I think, to actually be able to have time to produce it since you're living it. And I know I would watch that for sure. I'd love seeing stuff like that, especially when I see students or whoever, other healthcare professionals doing like more innovative things and getting more people interested in medicine in general. I'm always a huge fan of that. So especially if you have a desire to do some kind of a documentary thing, you can go iPhone cameras now are perfectly acceptable as far as recording. So you get easily just document your process and journey through school.
That'd be great.
Just my 2 cents.
Great idea.
But thank you all so much for taking the time to do this. And we will definitely keep in touch, and we'll post y'all's Instagram handles and everything, like I said, in the show notes, so people can contact you. But any other closing thoughts or anything before we get out of here?
No, we're just really grateful. I think that it's great to see everyone's kind of skills come together during this time, because it won't happen ever again, hopefully, in our lifetime. And it's so unique, and being able to see everyone come together in their unique ways has been really rewarding. So we're happy to be able to connect with awesome people like you.
Appreciate it. No, thank you all for being here. So, and thank you guys for listening. If you do have any questions, obviously their contact information will be in the show notes. Make sure you reach out to them. If you have questions for Cole and I, make sure you email us. You can reach us on any social media platform. If you like the podcast and you want to help us out, make sure you subscribe. You can text us directly if you want. The phone number is area code 415-943-6116. And we just greatly appreciate y'all taking the time to listen. Thanks, and we'll see you next time.